Hi, let's talk about the muscles of the pharynx. As you may recall, the muscles of the pharynx may be divided into two groups. There are the pharyngeal constrictor muscles and the longitudinal muscles, and each of these groups has three constituent muscles. Now, the pharyngeal constrictor muscles are what really forms the bulk of the muscular wall of the pharynx, and I'll outline them here. So we have a superior, a middle, and an inferior pharyngeal constrictor muscles. All of these are going to attach from bony elements anteriorly to the pharyngeal raphe, which is that midline seam, posteriorly. The superior pharyngeal constrictor muscle is going to originate on elements of the skull, namely the medial pterygoid plate and hamulus, as well as condensations of pharyngeal fascia called the pterygomandibular raphe, because it runs between that medial pterygoid plate, pterygo, and the mylohyoid line of the mandible. So most of that muscle is originating from that raphe. There's also a part of it that attaches to the tongue as well. And then we have the middle pharyngeal constrictor. The middle pharyngeal constrictor muscle arises from the hyoid bone. And then the inferior pharyngeal constrictor muscle arises from the larynx. There's two parts to it. There's the thyropharyngeal part and then the cricopharyngeal part that originate on the thyroid cartilage and the cricoid cartilage, respectively. Now, all of these muscles are innervated by the pharyngeal plexus. Now, the longitudinal muscles, of which there are three, are generally deeper than these pharyngeal constrictor muscles, with the exception of the proximal part of stylopharyngeus muscle. Stylo because it originates on the styloid process of the temporal bone, and pharyngeus because, well, it inserts in the wall of the pharynx as well as the thyroid cartilage of the larynx. When that stylopharyngeus muscle contracts, it is going to elevate the larynx, and by extension, it's going to shorten and widen the pharynx. Now, what's interesting about that stylopharyngeus muscle is that it is the one muscle of the pharynx which is not innervated by the pharyngeal neural plexus. It's innervated by the glossopharyngeal nerve, or cranial nerve 9. And the glossopharyngeal nerve has a very close anatomical relationship with that muscle, namely, it rides the posterior aspect of that muscle inferiorly across the back or the posterior edge of the pharynx. That muscle is also significant because it's a nice landmark between superior and middle pharyngeal constrictor muscles as well. So we've discussed the muscles of the pharynx from where they attach to the pharyngeal raphe and their innervations and what they do. Thank you very much for your time.